Hello, everyone. I am Dr. Audrey Arona. I'm the District Health Director for Gwinnett, Newton, and Rockdale County Public Health Departments. And I have received so many questions about long COVID that I wanted to give out some general information about long COVID to the community. And so let me just share my screen here, and I will launch right into this. So to define long COVID, we look at CDC's definition, and we also look at the World Health Organization's definition. So CDC defines long COVID as symptoms that persist weeks to months after COVID infection. And the World Health Organization is a little bit more specific in the timeline, requiring infection with persistent symptoms after 3 months that then lingers for an additional 2 months thereafter, and of which is unexplained by any other health condition. So let's go through some of the lingering problems that patients have experienced. Of course, this is not a comprehensive list, and I have highlighted some of the major organ systems affected. Just know that there are others also. The first one is, of course, the brain, which is very much affected by COVID. I'm sure you have either experienced it yourself or heard from others, the brain fog that many people talk about. As far as the lung systems go, or the pulmonary system, these are especially affected by often lingering cough, shortness of breath. Fatigue is a really big symptom. I know several patients who were previous runners that since COVID have been unable to exercise, let alone run. And some are still requiring home oxygen treatment still. So again, some of the other things that you see there can be worsened as well, similar, such as asthma. So for our cardiovascular system, or our heart, high blood pressure is a really big ongoing problem in two different ways. First, we've seen hypertension become a problem in patients without a previous history of hypertension. And secondly, pre-existing hypertension seems to worsen after COVID in a lot of patients. Other new or persistent problems include increased risk of stroke, arrhythmias, that's like heart beating just a little bit differently, like palpitations. That's an example of a arrhythmia, blood clots. We've also seen the need for pacemakers increase since COVID. The significance of that really is yet to be determined, but it'll take a few years to look backwards and compare. But just know that we've seen a lot of need for pacemakers increase. For our endocrine system, and basically an endocrine system is a feedback loop of hormones in our body that's released by internal glands like our thyroid gland or adrenal glands. And they basically regulate other organ systems and electrolytes like sodium, blood sugar, calcium, and others. So following COVID, we've seen lingering problems like fever, chills, diabetes, again, high blood pressure, thyroid, and other autoimmune, disorders like lupus, and others. We've seen others as well. And again, these are typically in previously healthy people without those conditions. Our gastrointestinal system is affected as well. A lot of people experience persistent nausea, abdominal pain, irritable bowel syndrome is a big one that we've seen, as well as digestive disorders like new food intolerances. So many patients come away from COVID with new or worsening joint problems. We know many of these symptoms across all organ systems come from COVID's exacerbation of inflammation, right? So COVID causes tissues to swell and inflame. So of course, joint spaces would be noticeably affected. And then lastly, some skin disorders like rashes, sores, eye and ear changes like hearing loss and visual disturbances. Even hair loss we've seen linger way beyond COVID infection. So how do we know all this is from COVID? And the reason we know all this is from COVID is by doing research studies. So let me share with you some of those. So this was the very first person to report long COVID by publication, and it's from Italy, Dr. Carfi and others. published in July of 2020. That's early in the pandemic, where they looked at persistent symptoms about 2 months after being hospitalized from COVID. Again, these were people sick enough to be hospitalized, first of all, and the authors followed these patients outpatient to see. And what they found was 87% of these patients had at least one lingering symptom after COVID. 32% had 1 to 2 persistent symptoms, and 44% of the people they looked at reported a worse quality of life after being sick with COVID. So a year later, now we're in August of 2021, and this is now after 175 million people worldwide have been infected with COVID, and this is now after 3.8 million people worldwide have died from COVID. So these authors did an extensive literature review of over 18,000 long COVID studies and reports to get their data that they concluded. And they found, this is a very busy slide, but they found 55 long COVID reported symptoms that were associated with COVID infection. Again, involving essentially every organ system like we talked about, but especially the ones that we've already mentioned. The most common these authors found was 58% people reported fatigue, 44% headache, 27% that brain fog or attention, disorders that we talked about. They also reported a strong associated with COVID and stroke, diabetes, and blood clots. 80% of people at the studies that they looked at had at least one symptom that lasted beyond 2 weeks, and 58% had symptoms after 100 days. So the authors really, at this point, concluded that more studies were needed, but the paper's main intention really at this point was to notify doctors to be aware of these symptoms in order to fully appreciate and understand how to manage the many medical conditions that these patients were experiencing after COVID. So the question is, why should we care about long COVID? So this study was published this year in February, and it looked retrospectively or backwards at people over the age of 65 infected with COVID who had persistent symptoms up to 4 months after. And the largest population to suffer the most with COVID and to be impacted the most is the 65 and older. And so this is really why it's important for us really to care about long COVID, because this has been shown to be pretty significant. But the authors of this study compared this group's findings to 3 other groups not related to COVID, including a group in the same age group infected with a respiratory illness other than COVID. And what they found is that 32%, 1 in 3 of non-hospitalized patients had at least one medical symptom that required medical attention. And hospitalized patients, 24%, 1 in 4 had at least one persistent medical problem that they considered severe afterwards. The most common of those were respiratory failure, heart problems, strokes, blood clot disorders, and neurological mental disorders. So lastly, this publication was the first one to look at long COVID that was more than 6 months after infection. And it's a much larger study of over 81 million patients, including more than 250,000 patients infected by COVID. And what they did again was looked retrospectively again, backwards in 3 to 6 months after COVID, and found 9 significant symptoms of long COVID, including most of what we've already mentioned. What I like about this study was that they compared the after effects of COVID to the after effects of the flu. A lot of people say COVID is just like the flu, so don't worry about vaccination, just let me get COVID, I'll deal with it, and then I'll get better and everything will be better. But this case clearly showed, or this study clearly shows, that COVID is not like the flu at all. Many patients have significantly more problems after COVID than what we see after infection with influenza or the flu, in other words. So again, this red line is how often we see issues with COVID, and then the flu is much down here. And this is a dramatic, very significant difference. Estimated based on this study and others, it's been estimated that 1 in 5 COVID survivors between the ages of 18 and 64 and 1 in 4 of the 65 and older population have a health condition related to COVID that they didn't have before, or that they had before and has got significantly worse. So then what about vaccination? How about vaccination? So, vaccinations help ward off long COVID, right? Or do they? And a lot of people, as you know, have gotten COVID after being vaccinated, right? So fortunately, there's been time for us to look and compare now to see how the vaccinated population does with long COVID. So we call these breakthrough infections, and getting COVID, after you've been vaccinated is what we mean by breakthrough infections. So this particular study was published a few months ago in May of this year, 2022, looking at the likelihood of COVID, long COVID, after breakthrough infection with COVID. And I want you to remember that this study was conducted for the period of time January through October of 2021. So remember, the vaccine had just become available in January of 2021. So this was way before any booster was approved. So again, we're looking at the population from the original vaccine. The authors wanted to know if vaccinated people who then get COVID experience long COVID. And again, they followed them up to 6 months after infection. And what they found was that vaccinated folks with breakthrough infection had much lower risk of long COVID, much less risk of hospitalization, and much less risk of death than unvaccinated individuals. And it's interesting, they even saw that those that did have long COVID, that their symptoms and conditions were less severe than the unvaccinated population. And that was true whether patients were immunocompromised, or not. They did show lower incidences of blood clots and lung and cardiovascular problems as well. So the real take-home message from all this is that the burden of disease from COVID is not trivial, even for vaccinated people, but it is certainly less than unvaccinated people. And lastly, I just wanted to share a couple thoughts with you, because really there's a lot more research that needs to be done on this. But, what about the long-term consequences of long COVID, down the road? And what is the longest duration that we'll see long COVID? Think about the cost to our healthcare systems that this is. Will we eventually see new treatments for long COVID? What about the new variants? This is really important because we've now, since these studies have been published, we've had all the Omicron variants, right? So will the variants make long COVID more likely or less likely? Or will the variants cause long COVID to be more severe or less severe? And then, of course, with this new bivalent COVID booster that just came out, will that help with long COVID too? So as you can see, we just have ongoing research needed to answer all these questions. Hopefully that has given you some information about long COVID to answer a lot of your questions, but also just to, to kind of give you some food for thought about things. If you have any questions at all, my cell phone is listed here. You may email me, you can call me or text me, and I'm happy to share information with you, especially as we learn more and more and more.